Hey guys, Colton here at Preferred Physical Therapy, where we help those 40 and above stay active and independent, live free from painkillers, and avoid surgery. Today, I'm going to be going over some cupping. I'm specifically going to go over cupping for the shoulder. Now, the shoulder usually is limited in a few different ranges of motion, typically overhead, out to the side, or kind of rotating through there. Now, with cupping, it's going to be a little bit more aggressive than me using my thumbs or my hand to kind of work those tissues to improve those motions. Cupping is going to have this vacuum seal using air pressure to make the tissues come into the cup, and I'm going to have this patient go through different motions of the shoulder to help improve blood flow to that area, reduce the muscle tension, and try to get some more mobility afterwards. Now again, this can be a little bit aggressive, and so we want to make sure that the skin integrity is there and it is pliable enough to do so. We're going to first start by having the patient go out to the side. We're going to notice his limitations. He's only able to go a little bit over 90 degrees, come back down, and then I'm going to have you come forward. Again, still pretty limited. We're not able to go all the way overhead. I typically like to use cocoa butter to help with the friction process so it's not so bad onto the skin. So we're going to use a little bit of cocoa butter and apply on the tissue surrounding that shoulder. We're going to use the cup here. We're going to apply the gun to it. How does that feel?
Good.
Doing okay there?
Mm-hmm.
How's that?
Good.
Doing okay there?
Mm-hmm.
And we're gonna go one more here. There. Now this is typically what we like to see. We like to see the raised skin through there, the redness through there, meaning the blood flow is in that area. If it does become too red, I like to stay right there and make sure it doesn't bruise. It is a very possible thing to bruise, but we don't really like it as much like Michael Phelps in the Olympics. So I'm gonna have you do those same motions we did there at the beginning. I'm going to have you do 3 or 4 of them in each direction. Now I really like this to improve the blood flow to the areas, make those muscles activate so we can reduce the tension afterwards. Good. That looks good. And then I'm going to have you do 3 or 4 into external rotation. Good, just like that. And they're easy to come off. We want to check the skin, make sure everything's okay. Good. And I'm going to have you do those same motions one more time to see if there's any improvement. Looks like we got a little bit more to here. We're able to be a little bit taller now out to the side. And that is a ton better than when we had earlier. Great. Now, if you feel like cupping can help you, please give us a call. Look us up on our preferredptaz.com website to know more about cupping, what it can do for you, and hopefully we can help you with your shoulder range of motion, some pain for your back, or even into your knees or calves. And hope to hear from you soon.